Thank you for joining us for this very special episode of LA County Close-Up. I'm Naiba Reynoso. After more than 3 years and 36,000 lives lost, the county's COVID-19 emergency declaration officially ended on March 31st. With focus now on recovery and moving on from the health crisis that unleashed chaos and uncertainty, here's a look back at how LA County rose to the occasion to provide relief.
5, 4, 3, 2, 1.
We would typically spend New Year's Eve with some friends, do the 9 o'clock New Year's Eve because the kids can't stay up that late, and then often would go to the Rose Parade the next day.
This is 2020, and once again, the Rose Parade treated spectators to a fantastic New Year's Day. This year's theme, the power of hope.
It feels like a long time ago, must say.
A state of emergency has been declared in LA County, where 6 new coronavirus cases have been confirmed. The announcement comes as the first coronavirus death was reported in California.
I think by the middle of January of 2020, we certainly were acutely aware at our public health department, I think probably most public health departments, that we were in for a rough ride.
The immediate impact is usually the first chapter of what's a really long book that we don't know what the subsequent chapters are going to be. But I think probably within that first month, we knew the gravity of it was going to be a long duration emergency.
There was so much at that time that was unknown. You don't know how severe the virus is going to be or how quickly it's going to spread. You don't know basic answers.
I have just signed a proclamation declaring the existence of a local emergency. I want to reiterate that this is not a response rooted in panic.
Everyone was looking for the same stuff. N95 masks, KN95 masks, surgical masks, ventilators, things that we just take for granted on any given day. By like March 15th, were nowhere you could find.
This simulation is meant to identify areas where we can improve upon our infection control. We're the best team that the county can have, but we want to be better.
Everybody in the room is aware we have a positive COVID-19 patient.
This morning, extreme measures across the country to try to slow the pandemic. The CDC now recommending no gatherings of 50 or more people, as top health officials warn it could get worse before it gets better.
Today we're here at Fairplex Pomona. This is one of the first places that we will be providing services to people that have been impacted by the coronavirus.
Having a hotel where everyone has their own bathroom, where meals can be delivered, is a godsend. We had nothing to prevent this virus from killing people at the beginning. Nothing, except to keep people away from each other.
Early on in COVID, before the safe at home orders were issued, we went on this hunt to rent recreational vehicles, and we built an entire quarantine and isolation site at Dockweiler Beach, which is probably one of the best views you could ever have from a quarantine site. But there were so many lessons learned in how inefficient RVs are for that type of sheltering program.
We are directing that all bars, nightclubs, wineries, brew pubs, and the like be closed in the state of California.
The order, which we are calling Safer at Home, is the next step to protecting our residents from the coronavirus by increasing social distancing. We can't tell you exactly how long these orders will be in place, but we all know it will be temporary.
This is the time to avoid all non-essential travel, This is the time to stop going to events where there are large groups of people gathering, and we need everyone to help us try to slow the spread of this infection.
Everyone has their ID? Okay.
So you're gonna cough 3 times into your elbow?
One of the highest priorities right away became testing. So the Emergency Operations Center became a big support and coordination element for the testing program.
We were looking at in-person mega sites in partnership with DPH and with fire. We were looking at drive-through lines, walk-through lines, and it was changing also by the moment.
Awesome, thank you. You can pull around.
That was a crash course in how to get things done fast and how to literally go from 0 to 60 on a topic that previously no one had thought twice about.
Food is really hard for us to come by right now. I can't seem to get full-time work.
That's why I'm so happy when I came and saw that, somebody cares,
Things are short at home and you have to take advantage when you have a family.
When there is a common threat, foe, or enemy, I think people will naturally band together, and that is exactly what we did in the county.
This is really on-the-ground government service, providing people with what they need. We're just providing them with a little bit of food, maybe a little bit of hope to get them through to the next stage.
We're here with Baby to Baby. For the families that we serve, the reality of this pandemic looks very different. It means lost jobs, cut wages, not being able to go to the grocery store because you're too afraid to take public transit.
It does feel good that you're able to help somebody out who's struggling right now. And that's the purpose of what the county board and many of us are trying to provide to our residents.
It's a big benefit and it's helpful just because, they're actually getting to learn.
In light of the COVID response, it's important that we educate the people experiencing homelessness.
Hello, good morning. The nurse here.
They really want you guys to stay protected, take precaution. Again, if you see anybody sneezing or coughing, turn away.
Tonight, the number of homeless people dying from COVID-19 in LA is rising, which is why state and local leaders are rushing to get people off the streets and into hotel and motel rooms.
Obviously, the future can be a little uncertain, especially for people in hospitality. And then suddenly Project Roomkey gave us the ability to have a rebirth.
COVID-19 has really presented an opportunity for us to invest the resources needed to bring people indoors.
The Emergency Operations Center, in relationship with the fire department's incident management team, started becoming probably one of the biggest hotel operators in the county during about a 6-month period of time to support what ended up being thousands of people that needed quarantine, isolation, or even just prevention from exposure by being in a more secure location.
LA County, LA City, all the other partners that are involved, we're trying to create a safe place. And we will be taking care of the communities in which we serve. We're all in this together.
There are lots of people who have varying opinions about the pandemic, whether it's real, whether it's fake. But it's real. We see it on a day-to-day basis. People are dying from this every single day. And I wish people would take it seriously.
Breaking news with this. Public Health Director Dr. Barbara Ferrer suggested that LA County's stay-at-home order will likely be extended for the next 3 months.
I remember getting asked at a board meeting, would this be over in the next month? And I remember saying, no, this would at least go through the summer. And I don't know how much everyone remembers, but that was the first backlash, point of really organized backlash. That was when the death threats started. That was when people got super angry. We've been home now for a couple of months. This cannot go on, and you're telling us that We've got to worry for months to come, and people were beside themselves.
And this is the first time in LA County history that we've had this significant of a disaster, but at the same time then added with other disasters. You know, we had the second biggest wildland fire in LA County history, civil unrest that started occurring, but yet the county mission still needed to go, and we all still needed to function in those environments.
I know our communities are feeling the immense weight of this weekend. Demanding justice and reform, residents made their voices heard. Because of the civil unrest, I declared a state of emergency on Saturday night to combat the violence that erupted.
COVID exposed, or maybe amplified is the better word, things that were hiding in plain sight, but it also gave us a platform to sit still, to be able to pay attention, to take it in, and to think deeply about what's happening and what it means.
The one issue we don't like to talk about a lot, but it is essential to the conversation on gaps, is the impact of racism. You will see a big gap between who's getting infected, who's ending up in the hospital, and who's ending up dead based on the color of people's skin and whether they're living in communities of high poverty. I mean, I hope that what we've all just experienced for 3 years has opened all of our eyes to the unfairness that exists.
So we're getting a confirmed COVID case in Recess 1. He's pretty stable, though. He improved.
74-year-old male. His complaint is just difficulty breathing with respiratory distress. Right now, we're just trying to find a bed location for him. How do you copy?
You can come here to USC.
What's his GCS?
We can go to you. Okay, perfect.
As COVID cases surge, the number of available ICU beds has plummeted.
Tonight, more people in LA County are hospitalized with COVID-19 than ever before.
Los Angeles County reporting its deadliest day of the pandemic so far. The death toll in the county now more than 10,000. That is the highest in the entire country.
The volume of patients coming through is just overwhelming. The number of family members that are sick, that are coming in groups, the not being able to allow families to continue to follow their patient upstairs, devastating to nurses.
I can't imagine what it would be like to not be able to sit there with someone I loved and hold their hand as they passed away. But again, in the midst of that surge, you're just trying to protect as many people as you can, and you're trying to protect the healthcare workers, and you're trying to reduce the spread of the virus, and you're left with what is really a terrible set of choices where there's no good answer. And to see that there wasn't broad acceptance and broad compliance among everybody of making even simple choices that could help to reduce the spread of the virus, it was really challenging and disheartening for a lot of people.
The risk is real, and a lot of people don't take it serious until it affects somebody they know or they love. I feel like I lost my soulmate, my other half. I love him so much, and I wish he was still here. So we have a lot of work to do.
We have now reached the second wave, the surge. It's happening across the country. We're still in the midst of a global pandemic, and whatever we can do to turn these numbers around until this vaccine is available, I think will be for the betterment of all the residents of Los Angeles County.
More help arriving in Southern California in the fight against COVID-19. I'm talking about the first approved vaccine arriving at more local hospitals. This week, doses are set to go into the arms of healthcare workers across our region.
This is such a momentous occasion. We
have been waiting for this for almost a year. Really, it's our frontline staff that deserve this vaccine, so I'm excited for them.
But it was such a sense of relief once that vaccine was finally available and once we could start to offer it to our workforce members. And as we know, the pandemic still continued for 2 years after that, but it was a change.
You could feel in the air the anxiety people had, because now it's like all that risk I've been managing, there's a relief valve to that, and I want that relief valve fast.
To put together a testing environment with 5 megapods is a pretty large endeavor.
Both private sector and governmental organizations that were running sites were flying out here to walk through our sites to then take back to their communities to implement. And that's always a pretty cool experience.
And people were crying after they got their vaccines with relief. Finally, I feel like I might not die from this virus. Finally, I feel like I have protections.
The only way we're going to get on the other side of this surge is to vaccinate more people, as well as encouraging people to stay safe at home, wear your mask, wash your hands, and socially distance.
Southern California's massive vaccine efforts picked up speed today as lines of people crowded super sites. Shortages, second shot anxiety, and even a protest at Dodger Stadium staged by anti-vaxxers that temporarily stopped shots have left many frustrated. Just 6.8% of all Californians have received a dose.
Vaccine hesitancy goes way back, and it's not necessarily confined to people who don't like government making rules.
Our history in America about how we've treated different populations is not positive, and there's good reasons why individuals might be afraid or nervous or anxious or might not feel like that vaccine is going to be a net positive thing for them.
The most important thing now is to get this vaccine. I've done all my research and homework, and I consulted my doctors, and they said this is what I should be doing.
I'm so proud to take this shot. Even in my neighborhood, there's a lot of tough guys that are talking about, yeah, I don't need no shot. Yeah, but Holmes, maybe your family does. To the community of LA County, ¿sabes qué? Get out and get vaccinated. And this is Machete talking.
I enjoy serving the public, but now that the libraries are closed, this is an opportunity to do something else that's really needed and that the public needs.
We had thousands and thousands of people who woke up one morning as a librarian and got sent to do food missions or become contact tracers for the Department of Public Health.
From the public health's perspective, the most important support we got for the last 3 years have been disaster service workers, and they came from every single county department. And that meant that every single county department had to shift their priorities.
The county needs more than 16,000 people to work the polling centers this November. Because of a possible shortage of volunteers, for the first time ever, LA County is turning to the Disaster Service Workers Program.
I think the biggest pivot of all was at that individual county workforce level. Employees stepped up in a big way and changed professions overnight, and some for long durations of time.
Once we got off the launch pad and reached our cruising altitude, we were able to put out requests for X number of employees to fill Y mission, and the county family stood up and delivered.
The COVID emergency is over, and we are, I know, all happy that the COVID emergency is over, but that doesn't mean COVID is behind us entirely. We need to live with COVID, we need to continue to protect ourselves from COVID, and we need to further integrate our COVID response into just our regular work.
Without like a functioning government, all the other components of society are going to really struggle when there's that disaster. So identifying those core aspects that we need to maintain regardless of what the emergency is step one. And I think COVID is probably one of the first real experiences we had in showing us that.
It caused us to talk about the truth that we all know, but we didn't really want to acknowledge, right? And so absolutely, it became the tip of the spear for advances in justice reform, healthcare reform, all of those areas that we probably would have gotten to eventually, but it acted as the catalyst.
Our team found out that we could do a lot of different jobs all at the same time, and we moved pretty quickly. I think one lesson from this whole pandemic is looking back, how quickly the county can move when it wants to.
I've never seen so much goodwill. I've never seen so much kindness. I've never seen people so willing to step out and take care of each other as I saw during the last 3 years. And I think it's important that we remind ourselves that here in LA County, the vast majority of people, not only were doing the right thing, but were kind to each other while they tried to keep each other safe.
Thanks for joining us. We'll see you next time on LA County Close Up.